And all of our attachments stem from childhood.
Yeah, it does. And so what we know is that fast forward, depending on if it's a secure attachment or insecure attachment, fast forward when you're in relationships with someone else, that sort of attachment style is your dominant attachment style. And so it has an effect on how you are going to relate. So how parents relate to you and how you relate to your parents has an effect on how later on in life, how you're going to relate to your significant other. And or even just at work or whoever is an authority figure to you. If you have issues with authority figure, all of that is based on early childhood experiences. And so you mentioned anxious attachment. Maybe things are inconsistent when you were a child. Like sometimes your mom was there, sometimes your mom wasn't there, and you're not quite sure if someone's going to be responsive. So maybe someone was responsive for a while, and then all of a sudden they just disappear on you. So maybe you have attachment injury. We call it attachment injuries in the in the mental health era. Maybe you have these attachment injuries, so you're not sure. You can't properly predict your environment. So when you get older and you start dating, and you give somebody your number, and they say they're going to call you, and then they don't call you, you're like, oh wait, what's going on? You start to have this anxiety, and you're like, wait, are they going to call me? Are they not going to call me? What's going on? So all of this has an impact on your attachment styles. So that's anxious attachment. Avoidant attachment, or it's that comes about where you don't really want to you want to try to avoid. Maybe some things are very painful for you when you were younger. Maybe you want to reach out to your primary caregiver and they shut you down. So avoidant attachments have a lot of shutdown, had a lot of somebody disregarded you when you were younger, or your primary caregiver didn't encourage you to talk about your feelings, didn't encourage you to ask for what you need. So fast forward when you're in relationships and you're with your significant other, you are apprehensive about asking for what you need in current relationships. So maybe you're avoiding. Maybe you don't want to talk about feelings. I don't want to talk about feelings. Feelings don't mean nothing to me. There's a lot of people who are just like, feelings, I don't care about your feelings. So what? We're together and all of this. And so they're dismissive. They can be very dismissive and avoidant early on, because as children, their feelings and their thoughts and desires were dismissed. And so when they get into relationships, then they can become very avoidant or dismissive.
Wow.
Yeah.
And what's the combination?
Yeah. So what
you got both.
we call it disorganized attachment. And so disorganized attachment comes from early childhood abuse. So there is this desire and this need when you were little that you would really, and we know this, by the way, all of this was studied very, very closely when they would interview infants. And so what they'd have their primary caregiver, not interview, but they would videotape infants where their primary caregiver would come into a room and then the primary caregiver would leave. And so they would record it and they would record the reaction of the child. So when you have children or infants, when their primary caregiver came into the room and they saw the person, you could actually see the child, even a toddler, kind of get up and go to their primary caregiver. They may cry a little bit when they enter the room, but they're apprehensive about getting too close to their primary caregiver. And so that signals to us, because my background is in social work and we're always making these assessments, so that signals to us that there may be it's possible that there's some type of abuse happening in that household based on how the child is reacting to the primary caregiver. So what are you like when you're in relationships? Well, it's almost like it's like a chaotic sort of attachment. So it's like you have this desire and need for closeness. But when you are actually close to somebody, it gets really scary, because when you were a child and you got too close to your primary caregiver and you made a mistake or you did something that, maybe was seen as shameful or seen as bad, that person punished you or inflicted harm on you and made things really uncomfortable for you or abused you in a way. So when you're in relationships, you may say, you know what, I need you close to me. I need you close to me. And then when you actually establish that level of closeness, to maintain that is very difficult with people with disorganized attachment, because it's very frightening, because being too close to somebody is always seen as something of a threat. So that's the disorganized attachment.
Wow. Imagine